Good evening, everyone. Welcome back to You and Your Health. We're excited to have you join our program this evening. My name is Erika Roberts Hilton, a co-host of this program, and I'm lucky to have two other co-hosts, Dr. Edward Isuman and Dr. Yvonne Palumpudov. Hello, Dr. Eddie. Hi, Marie.
Hello.
How are you?
Very good. Thank you.
So we're excited for you to be back on the program. Thank
Thank you
you
for
for
having me back.
accepting our invitation again.
I could never say no.
so, so you know Dr. Eddie already,
Yes.
and we have a new addition to the program, Dr. Yvonne Palumpudov, who is a colleague of ours at NIH and also a past presenter on the program. So
And
we
and can
kind
I
uh-huh,
please can I continue?
sure, sure.
She's here to spice the program up. Please take over.
She's here to make sure that when either Dr. Eddie or myself disappear for a little bit, that the program continues. And so we're so excited for her
Mhm.
to join the program and bring her expertise to the program as well. So we're going to get started. So I'm sure we have a ton of things to discuss. So Dr. Eddie, if you don't mind, take Miss Marie back and I can do her introduction and then we can bring her back on the program. Thank you. So Miss Marie Henry, our guest, is from Brooklyn, New York, and has been an advocate for seniors and marginalized populations for over 25 years. Ms. Henry has a bachelor's degree in human services and a master's degree in social work. Ms. Henry has worked in various healthcare settings, including hospitals, nursing homes, mental health, and dialysis centers. The list goes on and on. She's considered an expert in her field and highly recommended by her colleagues. And so we are grateful for her to take time out of her busy schedule to be with us this evening on the program. So if you're ready, we can bring Miss Marie back and then we can get started on the program. And she could be centered. Hi, Miss Marie,
Good
again.
evening. Thank you so much for having me. I am so happy to be back. Whenever I get an invitation to talk about social work, I'm just so excited.
So to the audience, this is pretty much structured as a discussion. So if you're watching the program, please feel free to send in your questions, and Miss Marie will be able to answer any questions that you submit. So Miss Marie, I know you were here the last time, and we talked
Mhm.
about multiple things. Particularly surrounding social work, providing support for patients, both inpatient and outpatient. And I was just wondering that if you don't mind letting us know some of the other programs that you support in terms of your work.
Okay. Well, first of all, I must say it is Social Work Month. March is
I
Social
had
Work
no
Month.
idea.
Yes, it is. So I have 2 more days to celebrate, but I've been celebrating all month. In addition to this lengthy resume Ms. Viega has given me, I've also worked with veterans, with PTS who suffer from PTSD. I've worked with the elderly population. I've worked with young children. Now I am doing care management, which involves a lot of education. We talk about preventive care. We talk about basic needs in the community, support for the families. We talk about Alzheimer's, dementia support groups. We talk about a variety of things. So my job basically is to make sure that these my members stay in their homes where they want to be in their last days, especially. I've also worked with hospice patients,
Mhm.
and I've provided education on advanced directives, healthcare proxies, living wills, a MOLS form. We talk about financial POA. We talk about estate planning. Everything that everyone, you don't have to be a certain of a particular age to have advanced planning. But
Mhm.
basically, it's something that everyone needs to really think about, because you want to make sure that your wishes are followed at the end
Mhm.
of life, especially if you begin to lose cognition or you lose your memory or you're incapable of making decisions. You want to make sure that you make the best choices while you still can, because you don't want just anyone making choices for you. So this is why I really stress a lot on advance directives when I talk to my patients, because it is something that unfortunately a lot of people don't think about until
Mhm.
it's too late, and everyone is scrambling around. Well, what would mom want? What would grandma want? Nobody wants to make the decision of pulling the plug because they don't know whether or not she's going to come back and haunt them. So I always tell families,
Mhm.
um, these are forms that I send out to. Well, I have over 200 members. I send out a form to every single one of them that does not have one, and they call me up on the phone, Miss Henry, what is this about? I said, well, remember we talked about, making your wishes known. This
Mhm.
is what we talk about, and we go through the process of completing the forms, getting witnesses. So, needless to say, I enjoy my work. I really do. It
That's good.
doesn't feel like working. It feels like I'm connecting, with my members on basically every level, because when we bring on a member, we have to look at every aspect of their lives. So the basic thing to do is a biopsychosocial. You're looking at their functional status. You're looking at the home environment. You're looking at the support system, the community resources. You're talking about informal helpers. The informal helpers are like the family members, the cousin, the nieces, the grandchildren who are able to pitch in or willing to pitch in. And then we look at the formal resources, like a home health agency that would come in and provide physical, occupational, speech therapy or hospice services. We look at other resources, such as financial assistance, Medicare, Social Security, Medicaid, you name it. We look at the gamut of things that they could be eligible for. So we connect them to resources to make sure that, in their last days, that they are at least comfortable, in the environment that they're in.
So you mentioned about the advanced directives and
Hmm.
what they need to know, what they need to do for to ensure that the family members is aware of their wishes and the forms
Hmm.
that you mentioned. So is there a particular like website that people can utilize within the state of Maryland or even Virginia that
Yeah, every state has their own advanced directives. New York has their own, Maryland has their own. If you go to the DOH Advanced Directive or Maryland DOH.gov, you should be able to find those forms. And the website, I think from the last resource list that I gave you, they
mhm.
should have that link in there as well.
Okay. Okay, we'll make sure that the
Hmm.
members have access to it. Dr. Yvonne, do you have a question? You're on mute. Okay, perfect.
Not at this time.
Okay. Okay. So another question I have, I know that COVID, with the pandemic, that perhaps a lot of things have changed since the
Hmm.
last time we saw you in December, was it November 2020? And I know that
Yeah, it
I've
was a while.
heard about folks getting benefits in terms of utilities and things like that based on COVID. Do you mind
Hmm.
talking about that program that Maryland has for
Yeah.
assistance, or for
Well, in
COVID relief
addition
assistance? Hmm.
in addition to the stimulus checks that people have gotten, they have also some new initiatives about water utilities. I mean, a lot of people had lost their jobs during the COVID pandemic, and they have a hard time getting back on their feet. So there are a lot of other resources that are put in place to help people navigate the system and see what exactly is out there. So I have there's an agency called the Maryland Coalition. Let me see. The Maryland, oh goodness, I forget. Hold on.
It's okay.
Anyway, I know you just get so used to these
Acronyms.
agencies, the acronyms. I don't want to start throwing acronyms around. Let's see. Let's see. It's the Maryland Consumers. Okay. Yes. It's the Maryland Consumers.org. Okay. And it's a program devised for older adults. And what it provides a lot of resources with tax assistance. It helps you determine determine whether or not you're eligible for Medicaid, Medicare, food stamps, utilities such as your electric bill, your water bill, or wastewater bills. So there's a lot of agencies out there that provide, but this is my go-to agency because I have a friend who works there, and usually when I have a friend who calls me and says, I'm having an issue with this, and they live in the Baltimore area or even in Maryland, I refer
Mhm.
them to that agency, and they are so wonderful. Wonderful people. They do great work. They also assist with advanced directives, and they also partner with the Attorney General's office, the American Bar Association, and the Office of oh God, what is it? OPC. There we go again. You have that list.
Yes, I
You'll
have
help
the
me
list.
out. You have
So,
that
so
list.
do they have to meet a certain criteria in terms of income to qualify for it?
Well, this program, they actually have a software where when they interview you over the phone and you give them your financial information, it will spit out every single thing that you're eligible for.
Hmm,
Yeah.
that
So
is
you don't have to do the legwork. You don't have to be on the phone holding on for half an hour. Like once the pandemic started, no one could get anybody on the phone. When you called the Department of Social Services, all you got either was a tone or a voicemail, and that was it. So I had to do a lot of back office work in order
mhm,
to find the cell phone numbers to these case managers in order for them
mhm.
to, hey, look, this I have a patient that's been waiting for waiver services for months. What's going on? So it was a challenge, but we got through it.
So, in your experience, for example, if someone makes over, let's say, $60,000, do you think they may qualify for some of the programs, or you have to be like under
They
a specific
may
number?
they may qualify because everyone's situation is different. If you own a home and you have a mortgage and you're retired and you own a fixed income, you may be eligible for services, I mean for resources that people who are of my age or before retirement age may not be eligible for. So I
Okay.
always tell people, always apply. That is the only way you're going to know. The worst thing that can happen, they'll say, well, you may not qualify for the full benefit, but we'll give you half a benefit.
Okay. Any idea how long the program may last? Because the numbers for COVID are going down. So,
No, but you know what? A lot of these age services have always been there. They were just never enforced because it wasn't really needed. It didn't come to the forefront until the COVID pandemic. So a lot of these agencies, programs, they do not end. Some of them, like the water assistance, that I think that was for about 6 months, but they're still accepting applications.
okay.
Yeah,
That is very good to know. And that list is on the list that you provided us,
it's on that
correct?
list.
Okay.
Yes, it
So
is.
we do
With
plan
phone
on
numbers.
sharing that. So
Mhm.
I probably that they might have she has a question. Like everyone has a question.
Are all these resources only available to the elderly, or basically is there an age limit on who can apply for these resources?
Most of these resources are for the elderly, however, but they're also for people who are disabled and under 65. So it's not just for the elderly. There are programs out there for people who are considered disabled who are on SSI. So if someone is on dialysis and they're getting SSI, they could qualify. If they're disabled, where they can no longer care for themselves, or they may have some form of congenital disease, or that prevents them from working, they could be qualified for these services as well. But like I said, everything is on a case by case basis. They look at the whole, your situation, which is unique to everyone, and then they decide what services that you would qualify for.
So does these resources
Mhm.
extend to prescriptions as well?
They do have resources for prescriptions as well. And I always tell families, always keep 211. I mean, that should be your go to number. 211 will connect you to so many different other services out there. Even homelessness. If someone is homeless and they're looking for housing assistance, 211 will find you, resources to help you find housing.
Okay. Another question I had related to COVID is that, as
Mhm.
you know, that there have been a lot of conditions, illnesses, or diseases linked to
Mhm.
COVID. I think last week there was a discussion about increased diabetes being seen from folks who have had COVID before. So I'm
Mhm.
wondering whether the state is providing any resources, for example, glucometers. I think high blood pressure too have been linked as well, that is being noticed within the
Mhm.
community. Are there resources for that?
Well, I know they're giving out the free COVID tests, but as far as glucometers and blood pressure machines and Lancets and things like that, most insurance companies plans do cover them.
Okay. Okay.
All the patient really needs is a prescription from their physician, and the pharmacy will find. And a lot of times, the pharmacies themselves, they have resources like AstraZeneca or GoodRx, where they can still
Hmm.
assist them in getting these free machines.
Okay. Let's check in with Dr. Eddie. Dr. Eddie, do you have any questions before we keep going?
No, yeah, let's keep going.
Okay.
No questions for now. But I'm
Okay.
just pulling the resources together so that any of them that she mentions, I can bring it to
Hmm.
the
On the screen.
forefront. Yeah. So she talked about Maryland Consumer Rights Coalition, right?
Yes.
Which was the one that I projected.
Hmm.
Yeah,
Yes.
Yes.
this one.
Yeah. Hmm.
Yeah, and I went through, and it has a lot of yeah, it
Yes.
has a lot of things that people can have access to. So you can go on
Oh,
once
yes. Hmm.
I pull up the stuff together.
Okay.
Hmm.
So another question I have is that we actually had a discussion in church this past Sunday, and that there is an increased
Hmm.
risk of suicide among youth, and it's a concern of our church. And so I'm wondering what type of services that the state have for mental health,
Hmm.
those suffering
Even the
from that.
coalition, even the coalition has a program that actually connects people to mental health services, if in their area. So I know the what is it, the Mental Health Institute. Let's see. Now, Johns Hopkins, they also have a mental health program. If you
Okay.
go to Levendale, they also have mental health programs. I've worked with a few agencies that provide psychiatric rehab services, and it's a program that supplements psychiatric care. So not only do they provide a psychiatrist that prescribes medication, they also provide the mental health piece where they can get a mental health therapist weekly. And then there's also the psychiatric rehab part, which basically goes into the home and assists. We've had a lot of young children who suffer from anxiety and insomnia since this whole pandemic started. They've not been able to hang out with their friends, be in class and school, fooling around with their little friends, and they've basically been confined to the home for almost 2 years. Well, it has been 2 years. I think March 23rd was the day they shut down everything.
Hmm.
So it's been 2 years, and it's really taken a toll mentally and physically. We've seen a lot of obesity in children as well as adults since the pandemic started, because they're not able to go outside and exercise. So we've seen the ravages of this pandemic, and well, thank God we're we can see that there's an end in sight. But of course, you're never 100% safe. Yeah, so I still tell people, I still wear my mask wherever I go. I still carry my hand sanitizer, but there is help out there, and a lot of times the mental health, your primary care physician is a go-to. And if you Google mental health services, I mean, you will find a listing of every aspect of care. If you're a veteran, go to the VA. They have mental health services available to veterans, whether you're active or retired. Um, there are a lot of resources out there.
Okay. Dr. Yvonne, you have a question.
Yeah. So I guess with still along the lines of mental health, what are some actions that you would recommend that we can take as individuals to promote mental health wellness? And how can we raise this
Mhm.
awareness and also stop the stigmas of mental health in our communities?
Mhm. Well, education, education, education. Because I think lack of education is really what keeps people from going and ask for help, because they assume, well, something is, yes, something is wrong. Things are not what they used to be anymore, and this is a new norm for a lot of people, having to deal with the loss of a loved one, to COVID, and it's very traumatic for them. And a lot of times people just don't want to talk about it. But that's the first thing you have to do. You have to talk to somebody. And, not everyone has all the answers. We all go through these challenges, and where we ask ourselves, wow, where's the help? Who can I turn to? So I always tell people, you have friends, turn to your church members, even a coworker. And like I said, your primary care physician is always, a first resource for you. And I tell people, if you don't feel that your primary care doctor is listening, then you need a new primary care doctor. Because that's where everything is, especially if you are, of if you're not of retirement age and you're still working, and you belong to an HMO, that would be the person that you would get a referral from. So if you have to go out and seek another physician, then by all means do so. But I always tell people, talk about it. Talk about it, because a lot of times we can be the best support for each other. When we feel that nobody understands what we're going through, that person may be going through exactly the same thing, but because you're not talking to each other, nobody knows, exactly how to help each other.
So along the same lines of what Dr. Yvonne had mentioned in terms of the
Hmm.
stigma within our population,
Hmm.
African Americans, I think one of the concerns may be documentation of the discussions. So confidentiality
Hmm.
is a big factor among our
Hmm.
people, because they are afraid that it will go somewhere. And I think back in the day too, they used to make it appear as if having seeking mental health counseling,
Hmm.
that this will be stamped with your insurance company, and therefore the insurance could um, um, not either pick you up for the next
No,
time around and things like that. That's so
it's an
far from the truth.
entitlement. That's an
Exactly.
entitlement. That's an
Exactly.
entitlement. They cannot turn you down simply because you have a diagnosis of anxiety, depression. Now, um, don't everything that you discuss with your mental health therapist is privileged information. Okay. Now, there are instances where um, your information can be shared, only in the event that they feel that you are suicidal or homicidal, or you're threatening someone, or they know that you are planning to hurt someone, and they have the burden. What is it called? You have to inform. They have the duty
Mhm.
to inform whoever this person is that you are threatening to hurt them, to harm them. But your mental health is your mental health business, and that's between you and your therapist. I tell people all the time, um, if you don't tell people what your needs are, they can't help you.
Yeah.
And suffering in silence is the worst thing you can do.
Yeah. And I think they also do have to inform if, in the case of of abuse. So if you report an abuse, they have to report
Mhm.
it. And I actually used to think that you have to be under 18 for them to report. It sounds like any age range. It's as long as you tell the counselor that you've been
Oh,
abused, regardless of
hmm,
how long ago it was, that they still have a
yeah.
duty to report.
I
Um,
worked with a couple of mental health agencies where I had clients who had been sexually molested as children. And basically, some of them never told anyone until they came under our care. And some of them actually did tell people, but no one did anything. So this person could be 30 years old, they could be 40 years old, and this assault may have happened when they were in, under, a minor. You can still report it.
Okay. Okay. Now, yeah, I was kind of shocked when I read that last week, and I was like, "Oh wow!" I thought it stopped at some point. I
Yeah.
had no idea that if they've never reported it, that regardless of your
Mm-mm.
age range, they can still be reported. Um,
If
so,
if it happened when they were a minor, yes.
if it happens if they're a minor, okay, okay, so then they can still be reported. Okay, all right. Well, that's good to
Mhm.
know. That that trail never ends as long as someone's there to listen
Someone has to
and
be
take
accountable.
action about it.
Hmm.
Yeah.
Hmm.
So you had given us a resource called the Soar program for adults. Do you mind going over that? What exactly that program?
That's the Maryland Consumers Coalition. That's the one that
Oh, that's the same
Dr.
program.
Sumi brought up. Hmm. Yeah.
Okay.
Yeah. They
Okay.
also have nutrition resources as well, where they had
Hmm.
food banks that nobody really knew about. And SOAR was basically the only agency that was able to provide me with a listing of all the different agencies that were giving out food pantries that were giving out food to the community.
Okay. Okay. That's the idea. I guess whenever you get a moment, if you don't mind projecting that, it would be good to kind of
Mm.
take a look at it. If anybody have a question before I keep rambling on.
Not at this time. You can keep
Okay.
going.
All right. So, if you don't mind discussing with us some of the benefits of long-term care, I think,
Mhm.
not everybody kind of consider that as part of their
Mhm.
benefit package because you always think, especially, folks who are young, that you never may need it, right?
Mhm.
And so it'd be good to know whether
Mhm.
you recommend folks
Mhm.
from having and what age group should definitely consider long term as part of their benefit package.
Well, if you my age, you need to think about it.
Give us an age range. Is it 30 and up or
Anyone
40
over
and up?
50.
Anyone
Um,
over 50.
but
Okay.
you can, okay. Let's when you have I would say 40 and up. If you are employed and your employer is offering you long-term care insurance, take it because as you get older and you begin to collect diagnosis after diagnosis, you may not be such a good candidate for long-term insurance. So if they're offering it to you, take it. If you find a good deal out there, take it.
Okay. I was going to ask you, do you suggest getting outside benefit as well besides your work? Like,
Yeah, because you know what? The one that your job offers, it may have limitations. It may have a cap. If you go, you could never have too much insurance. That's what I tell everyone. Because your the one that you get through your job, it may only reimburse you up to maybe $100 a day if you end up in a long-term care facility, or if you end up needing long-term care at home. Let's say you need help with your personal hygiene care, you need assistance with homemaking. You may not have the extra money, and you're not going to find an agency that's going to charge you less than $300 a day. So if the cap is $100 in coverage per day, you're going to need that extra cushion.
okay. And it's similar to disability insurance as well, right? Because they do sell
Yes,
that
because
outside.
Medicare will only cover so much. The rest is coming out of your pocket. And if you make just a little bit over the income threshold, you are not going to be able to qualify for Medicaid.
Mhm.
So insurance never hurts. It never hurts to have more insurance.
Yeah. And like life insurance as well, because you have this life insurance with your job. My girlfriend and I were having this
Mhm.
discussion earlier
Mhm.
today that you could be with a company for 15 years and have life insurance, but then once you
Mhm.
leave that job, you
You
no longer
lose it.
have that benefit. So it's better to get something outside as well and kind of have
Mhm.
both of them. I
Right.
think that the difficulty in making that decision has to do with it's term or whole, because as we know,
Mhm.
whole may be costly. Some of them
Hmm.
is like almost like a car note to get home.
Or
But
more. I mean, imagine you on a fixed income. Let's say you retired, you getting $1,200 or $1,300 a month. That premium alone could be $500.
mhm,
You still have to think about your other, your other responsibilities.
yeah,
Um, so it doesn't hurt, to shop around. And some of the banks are actually offering life insurance, and
yeah,
a lot of car insurance companies now, they're bundling
they do too.
life,
Yeah,
car, auto, motorcycle, you name it, boat insurance.
they actually do. Yeah,
Hmm.
and some of them are a little bit cheaper too. Obviously, if you bundle, then it would be much cheaper
Yep,
than
if you bundle, yep, you'll save a
yeah,
lot of dough,
yeah.
save a lot of money. Yeah.
So, Dr. Eddie, do we have any questions, or I tend to ramble on?
Dr. Eddie.
Yeah, we don't have any
Dr.
questions. I mean,
We don't
people
have
are
any
watching,
questions.
but there are no questions.
Boy.
Okay, give me a second. I have one here.
Okay,
Uh-huh.
okay. Of course, we have a question from my favorite
Yeah, I
auntie.
mean, it's
Miss
just a
Jane.
suggestion.
As a community, we need to
Yes.
be in
Yeah.
tune with each other's emotional needs and offer genuine
Hmm.
assistance.
Yeah.
You are
So,
absolutely correct.
yeah. So I've had experiences where employers were not very kind, to their employees, and I always say, if you feel devalued, unappreciated, um, you might wanna, and if you're feeling stressed, because a lot of people, they don't understand what you're going through, or they may understand, but they just don't care. And if you feel that you are entitled to family medical leave, FMLA,
Mhm.
if you feel at some point you're getting too stressed, you cannot perform on the job, you staying awake at night, concerned about job performance, or job security, and you need time off from work, you have the right to go to your primary care physician and tell your physician, you know what, I am burned out, I need a break, and you can apply for FMLA and take
I'm
the break
back.
that you need.
Okay.
I'm back with a
I have a
very
Welcome
question
important
right
back.
after,
question.
after that question, after Dr. Eddie's question.
Okay, so someone said she visited and she's trying to get health insurance, but she has no social security. She has nothing, just a passport, and she
Hmm.
visited from Africa, Ghana to be precise. Where can that
Okay.
person go to get a health
So is
insurance?
she on a visitor's visa?
Yeah, the person is on a visitor's visa.
Okay. Yeah. A lot of times, without a social security number, you can get a tax ID number. And Valega, I'm gonna have to get back to you guys on that. Okay. Let me just make a note
Okay.
of that. Mhm.
Okay.
Okay.
Um, there is a resource there, that helps with immigration issues. Um, Dr. Sume, you should have it in one of the in that handout that I gave you, Valega, last night.
Okay.
Okay. Okay.
Yeah, there's
Let
an
me
Yeah, that's
try.
part of
Let me try
immigration.
project.
Yeah,
Let me
yeah,
try
it
projecting
has.
the handout
it might be on the PowerPoint.
on the PowerPoint. Yeah.
Hmm.
Yeah, that's a great question. I think, you know, back in the days, and not to age myself, but like in the 90s, people would come and not have social security and still be able to kind of, get some
Hmm.
benefits. You might get a
Yeah,
number to be
times have
times
changed,
of
and
change. Yeah.
they sure have. Um, no, it's the other one that's typed out.
Okay.
Okay. So
Yeah.
yeah, it's probably part of the list of
It was
community
added on last night.
resources.
Will it be
Okay.
Yeah.
something that the Maryland Pro Bono Center will
Yes,
be able to help with?
yes, that's the one.
Okay.
Yeah, yep,
I'll share that
that's the
one
one.
very soon.
Yes.
Oh, that's great because that was one of the questions I had, which is what are some of the services available through the Maryland Pro Bono Center?
Hmm.
Do they offer any legal help?
Hmm.
For
And
example,
I
if
think there's the
somebody
justice group. Where is that? Hold on a second. Blake, I sent it to you last night. Let me just
So I
pull it up.
sent Dr. Eddie. Can
Yeah,
you just go through the
I would
slides
project
because
it.
it's probably
Just
part
a
of the
second.
slide.
No,
Okay.
it's the second document, so I'll project it very soon.
Okay.
Okay.
Yeah,
Okay.
you can keep on talking, and then I would have it on the screen. Just a second.
So if they can provide, I think I've heard that they do help with divorces as well. Not that we're projecting, saying that
You're not encouraging
this
divorce.
no, this is a church program. There are no divorces. But I think that
Stay
one
together.
of the
Stay
services,
together.
stay together. That is one of the
Stay
services
together,
that they
please.
provide as well. And child support issues as well. So they do provide an array of services.
Right. They also support like
Stay
mental,
together.
They
like
support
mental
what?
health, misdiagnosis. Let's say if you're dealing with some legal issues with the misdiagnosis that she had, or like a wrongful death suit or something. Are these things that they could also help with?
Yes,
And like
they
domestic.
every
Mm,
aspect of legal issues, and if they don't have someone on their staff who actually does that, there is a referral source for you.
Okay.
Okay.
So this is the document we're talking
I
about,
can't.
right? You
There's a
can
Q
see.
and B. I think this that mainly may apply to Medicare and stuff. I know it's definitely on the PowerPoint presentation.
Okay, so there's
Um,
the Legal Aid
mhm.
Society, and there's the Maryland Pro Bono Center. It should
Yeah,
be at the
and I
just
think you provided the numbers as well, the phone numbers. So
yes, I do. It's 410-951-7713. That's the Legal Aid Society. And then the Maryland Pro Bono Center is 443-703-3053.
443
Uh-huh.
703 3053.
3053, yes.
Okay.
yeah, and Andy, if that person's a church member, it will be, once you post it, because that number is it's on the
Mm-hmm.
on the PowerPoint slides, along with additional phone numbers and links. They can just click on it and be able to access those programs as
Okay.
well. So I think, yeah, if we keep going down, continue. So keep going. Yeah, these are different resources.
Mm-hmm. There's the suicide prevention hotline. They're all in
Yeah,
there. Mm-hmm. Mm-hmm. Mortgage
more
assistance, adult
assistance. Yeah,
protective services.
Okay.
Yeah, the tax credit assistance program is on there as well.
Yeah, this is a
yeah.
tax credits assistance program.
Mm-hmm. Mm-hmm.
And then there's the hotline for Miss Jamila Blake, social
Mm-hmm.
worker.
Mm-hmm.
Mhm.
And then to apply hearing impaired, you can use
That's
this
for
number.
Metro. Yeah, that's
Okay.
Montgomery
That's for
County Metro
Metro.
Access. Mm-hmm.
Okay.
Hmm.
Then we go up a little bit, and
Yeah,
then
go all the way up to maybe slide 3 or 4. I think it starts. That's where the resources start.
Oh,
Okay,
hold on. Go back a little bit. One more. Okay, here.
yeah,
Here it is.
mhm.
The legal aid
And then the pro bono center.
in the Pro Bono Center. Mm-hmm.
Okay.
Mm-hmm.
so go to the next slide. Let's ask, a question regarding food-related services. So, like food banks, do people just kind of call the banks, or do they have to apply to be able to get
Yeah,
services?
you call that 866 number 821-5552. You give them your area code. I'm sorry, your zip code, and they'll tell you which food banks are available in your neighborhood.
Okay.
Okay, and then that's the
Or 211, like I said, 211. I mean, it's a resource for all Marylanders. Even New York has been using 211, so I think it's used nationwide now. To
Okay.
link you to resources, housing, nutrition, you name it. It's like
okay.
a one-stop shop for everything. Mental health services.
Okay. So what is the full name for the HEAP
Um,
abbreviation?
Yeah, it's Home Energy Assistance Program.
Home energy assistance program. So
Hmm.
they provide services or help for gas and
Ut-
electric.
Utilities, yes.
Okay, okay, including water.
The water one is a separate one. It's on that. Go back to the PowerPoint before this one. Lower. Scroll down a little bit. Mm, hold on. Mm, hold on a second. Okay. Give me a second, please.
It's
Excuse
probably
me. Hold
definitely
on.
on there.
I printed it out last night.
Okay.
Yeah, so I think these are very important information for people who have been affected by the COVID
Hmm.
and need assistance, but they don't know where to go.
Right.
So,
Yeah.
especially with this HEAP program, I have recommended it for a lot of
Okay.
people that I've come
It
across, and
seems to
they
be
have tried
missing
to
from
implement.
your.
Uh,
It seems to be missing. I'm not
Yeah.
seeing it. Okay,
okay.
but it's the household and wastewater assistance program.
Hmm.
Okay,
Oh,
I
I
don't have
think
a
it's on
phone
there.
number, but I have. You see it?
Dr. Eddie, can you start from the first one, please? Because
Okay.
I remember typing it. And then let's just keep kind of going through.
Okay.
Um,
Household and wastewater
yeah.
assistance.
That's it.
Okay.
That's it. Yeah.
Yeah,
Mhm.
but without a telephone number. So if you
Yeah, I think
can,
it's a
There's a
link.
website. Yeah, it's a
there's a
link.
website. Okay.
You just have to.
And for people who feel that their utilities are too high, you can contact the ay, 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 OPC. Hold on.
Is it at the OPC?
It's yeah, the OPC. Me and my abbreviations. OPC.
And
And then perhaps we can talk about holistic health and wellness and nutrition. Like, what type of services do they provide? I know you provided a name, Miss Lakey. Um,
Hmm. Yeah, for people who have nutritional issues, diabetes and the high blood pressure. I mean, a lot of my patients, they still don't know that there are certain foods that you really should just be staying away from when you suffer from
mhm,
diabetes and high blood pressure. You know?
mhm,
So this is a diet, nutrition, exercise expert, um, and it's a resource that was sent to me recently. I have not spoken to this actual person, but it's also a
mhm.
resource that I feel that I could throw in there as well.
Okay.
No.
Do you know whether you have to have insurance or is it a free service from the state?
No, it's not from the state. It's through a hospital. What's the name of it? And your insurance actually does pay for nutritional counseling.
Okay. Okay. Yeah,
Okay.
there's a ton the insurance pay for that's never advertised. It's similar to getting a new job. They might
Exactly.
tell you one
Exactly. Because
time
they don't want you to
about
know.
your benefits. They don't want you to
Yeah.
utilize it because
And
then
you
they have
better
to pay
remember
for
it.
it.
You remember? And you know why I tell people whenever you have you've signed up for a new insurance, ask for a provider directory
Hmm.
because they can't withhold that information from you. That provider directory is your Bible.
Okay. Yeah. You had mentioned earlier about hospice care. And I'm kind of
Mhm.
curious as to what programs they have for hospice care because I think it's certainly a challenge whenever folks have to make that decision. And then if you have to pay for it as
Mhm.
well, it makes it even more difficult. So, do you know of any programs that
Well,
um,
yeah.
people can access?
Well, you don't pay for hospice. Medicare covers hospice.
Okay.
The only the only it's hospice is a program. So I think the misconception hospice is a place that you go to die. That's not so. If your doctor gives you a window of 6 months or less to live, you qualify for a hospice, and Medicare will cover those programs, which includes a hospice physician, a hospice nurse, a hospice social worker. Okay, and all the equipment that comes with it, the hospital bed, the commode, the Hoyer lift, every piece of equipment that you could think of that comes with that oxygen, you name it. Um, so Medicare will pay for that. However, Medicare does not pay for someone to be there around the clock. That's the misconception, that if you're on hospice, that, oh, you're going to get all the care that you're going to need. It doesn't. That's not what it is. It's the supportive services that Medicare pays for. However, they do not pay for room and board. Now, the only time that Medicare, not Medicare, Medicaid pays for room and board, but
Behavior.
Medicare, the only time that Medicare will pay for home room and board, or for you to be in a hospice home, a hospice house, is if the person is imminently dying. So they said, well, you know what? The doctor says, well, there's a prognosis of maybe 2-3 days, maybe a week.
Mhm,
Then that person is eligible for inpatient hospice or GP. Okay,
mhm.
that's inpatient hospice. It could be in a hospital or it could be in a facility where Medicare will pay for it. Otherwise, if the doctor says, well, I'm giving the person 6 months, they cannot go home because they have no one to care for them, they go into a nursing home. At that point, the nursing home will apply for Medicaid to help pay for the boarding. The boarding meaning the bed that they're occupying or the room that they're occupying.
Okay, I've heard of instances where folks have been, in hospital for like 6 months or so, and obviously they continue to live, and they have to be
Mm-hmm.
discharged home and things like
They
that.
discharge them from hospice. They discharge them from hospice. Just because they're discharged from hospice doesn't mean that they have to actually go home. They don't necessarily
Okay.
have to go home. They can be off hospice and still be in a skilled nursing home because they still need assistance with their personal care. They need their
Mhm.
medication management and
Okay.
pain control. Yeah.
Okay. So in terms of benefits from either Medicare or Medicaid, it still continues, even though
Mm-hmm.
the in-home
Mm-hmm.
hospice
Yes,
or
has ended.
has
Mm-hmm.
ended. Okay.
Mm-hmm.
Okay. But there's a lot to think. There's a lot to think. Okay, Vaughn, you have a question.
Yeah, so for hospice and nursing homes and similar institutions, does the patient get the opportunity to choose which ones they want to be in, or either the patient or their family, or are these specifically assigned and you can't really change it if you don't like the service there, or versa?
Yeah, you can transfer. You have a right to transfer. You don't have to stay in a place you don't like. If you feel that your loved one is not getting the proper care, you have the right to say to tell to the social worker, I want my mom or my dad transferred to such and such place. As long as the facility has a bed, the bed, and they will accept them. That's what I always tell people. Do your homework first. Don't go to the social worker and say, I want to transfer. Go to the facility that you want and you tell them, this is where I want my mom to be, or that's where I want my dad to be. I want a tour of your facility. I want to know the ratio of aid to patients. So if you have a facility where they have 15, 20 aides, 15, 20 patients to one aide, your loved one is not going to get the attention that they're going to need. And that's what's been happening I mean, it's been happening for a long time, but it's gotten worse since the pandemic. So you definitely want to go and ask these questions. You want to tour the facility. You want to see, um, how clean is this place? You want to see what the nursing station looks like. You want to see the attitudes of the nurses at the nursing station. I mean, walking into a facility you can amass so much information just by walking in and just listening and just watching.
Mhm. So we have a question.
What services do the hospice volunteers offer? Um, okay. I don't know too many hospice volunteers, but they are around. Certain hospitals have hospice volunteers. Certain nursing homes have hospice volunteers. However, for home hospice, I'm not sure that even exists.
Hmm.
That but they are there for emotional support to the family. If a person is living at home and there is a hospice volunteer, what they do, they come and they'll stay with the, with the patient while the family goes, and runs errands or take a breather. So it's a really great service. I really wish there was um, more of it out there that we could refer our patients to. And there are a lot of people that are willing to do it, but they have to connect with an agency in order for them to provide that service.
Okay. So as a social worker, do you help with transition? For example, if someone's moving from a skilled facility, from a hospital to a skilled facility to perhaps,
Hmm.
home hospice, like do you help with the
Hmm.
entire
Hmm.
process?
Yep.
Okay.
Yes. Yep. You give the family a list of facilities that may have beds available, and if it's an HMO, you definitely want to make sure that you don't want to go out of that network to make sure that this patient is not being bounced around from one place to another. It's happened before, where the family chose a facility and then 3 days later they find out, oh, we really don't take your insurance. I don't know how that could happen, but things do
Mm.
happen. And they ended up having to move to a face. And the last thing you want when someone is on hospice or someone is actively dying, the last thing you want to do is to be moving them around. And insurance companies are notorious for saying yes in the beginning, and then when they get that hefty bill, then they turn around and say no. But Medicare doesn't work that way, thank God.
That's good. Let's see. Teddy, do we have more questions? If not, then perhaps we can look at the PowerPoint one more time. And okay, I
Oh,
think people are
thank
just typing.
you. I got a blessing. I got a blessing.
Yes.
Thank you.
So, Dr. Eddie, do you mind put okay one more
Mhm.
time, and then
Yeah.
because of time, we can just kind of go through quickly to see if we missed anything that you want to expand on before we go off. So, if you don't mind going to the next slides, Dr. Eddie.
Well,
So
we did
we
that.
did that, yeah.
Mhm.
I believe we did that as well.
Mhm. Mhm.
Okay. So, what is a QMB? What is a QMB application?
Well, the QMB program is for people who don't qualify for full Medicaid. So you
Mhm.
have Medicare, right? But you don't but Medicare doesn't cover everything. For instance, you have a patient who goes into the nursing home, Medicare is covering the first 20 days at 100%, right?
Mhm.
But after day 20, Medicare only, as long as they continue to qualify for Medicare services or what they call skilled services, like medication management, physical therapy, occupational therapy, speech therapy, um, then, or IV antibiotics, or even, peg tube feeding. So these are skilled services. But once that point comes after those 20 days, if the person still continues to need or qualify for these services, Medicare will continue to cover, but only 80%. So there's still a 20% out there waiting for you to come home and slam you in the face. So
Yeah.
at that point, for those people who do not qualify for full Medicaid because just slightly over income, the finance department or the finance department or the business office at the nursing home, they will apply for this. They will put in a Medicaid application. They still get credit. They may not get the full full Medicaid room and board, but um, they still get a subsidy. Okay, so if you're living at home and you have Medicare and you have certain medications that are not covered and you need that little cushion, or um, you paying your Part B of your Medicare, which is about $140. So
Mhm.
Medicare Part A pays for your doctors, but Medicare Part B is what pays for everything else, including Part C and D, which includes medications. Then you have other doctors who just simply don't accept um, you know your insurance. You have that QMB to fall back on. So this is why I included that application. That
Mhm.
application, I was, and there's a phone number that you can even call and complete the Medicaid application over the phone, and they'll tell you, and you'll get a decision within a few days as to whether or not you qualify. And sometimes they will tell you right over the phone, as long as you have all the information that they ask you about your finances, and they'll tell you over the phone whether or not you do qualify for that QMB. And if when you do qualify, that $140 that people are paying for their Part B of their Medicare, that money is since then put back into your Social Security benefit. So let's say you're getting $1,200 a month and you paying $140 for your Part B, you getting that extra 140 added to your regular
Mhm.
benefit.
Okay. Yeah, I don't think I've ever heard of that before. So that's certainly very good for folks to know about.
Hmm.
We have a couple more minutes. Dr. Eddie, do you mind going to the next slide so we can see, I think, in case we didn't cover something else? Okay.
I have a
Thank
question.
you. Yeah, sure.
Are there any resources to support family members who are probably dealing with compassion fatigue or burnout from maybe taking care of a loved one that is dealing with some kind of illness?
Well, it all depends. Mm-hmm. Well, it all depends on what it is, what kind of support that you're looking for. Um, if you have someone, a loved one who's suffering from Alzheimer's, the Alzheimer's Foundation have groups, and there are a variety of places that offer that support. Of course, they charge, but there are places like churches, for instance. They do some of these churches, just like they run AA meetings, they have support groups as well.
Hmm. Okay. But there's not really like a statewide, uh,
No,
support
no,
system. Okay.
no. There's not a
Okay.
statewide bank for that. No. Mm-mm.
Okay. Okay. Well, do you have
But if you
anything?
reach out to your if you reach out to your local hospitals usually do have that type of support. And and then bereavement services, of course, people always think bereavement services or after a loved one has passed, they were on hospice and they've passed, and now bereavement services are available. I always say, when you have someone who's suffering from Alzheimer's type dementia, you're already grieving that person. So it's always a good idea to reach out to your clergy, because honestly, this one of those things that even though it's inevitable, you never get used to it ever. But if I do find some resources, I will definitely share that with you, Valega.
Okay. And
Yeah.
then the other resource that the other viewer also requested in terms of getting
Hmm.
some health benefits and not
Immigration.
having this immigration. Yeah. Okay.
Hmm.
So we only have
Well,
two.
it's not.
Mhm.
Yeah, that was the OPEC, the OPC. I'm sorry, not the OPC. That was the pro bono services.
Yes.
Yeah, and the legal aid.
Hmm.
Yeah, they're the ones that can
To be
address
able
the
to.
immigration issues. Yes.
Okay.
Hmm.
Okay.
Hmm.
All right. Dr. Eddie, we're getting ready to wrap up. Do you have any other questions or before we let Miss Marie go? We only have a minute left.
Today the time has been so short for
Oh, and
Miss
I
Marie.
know.
one more thing I forgot to
Sure.
tell you. If anyone, if you have a loved one at home and you're suffering from caregiver strain,
Mhm.
your EAP
Hmm.
program at your job is a very, very, very good resource,
Okay.
Okay.
because I did some work with Blue Cross and Blue Shield about a year ago, and that was my role.
Okay. That's very good to know. But thank you,
Very
thank
good
you,
resource,
thank
your
you,
EAP.
Miss Marie. We
Yes. I
certainly
mean, they
appreciate
may not show up on your bill on your paycheck. It may not. Yes, it may not show up on your paycheck
As a benefit, right?
as a deduction, but it's a benefit, okay,
Yeah.
that they're not going to tell you about until you need it. So, yes, make very good use of it.
Okay, great.
Thank you,
Thank you.
Jane.
Thank you so much. Thank you for coming back, and we certainly hope
Oh,
you accept our invitation the next time to bring additional information to our members. This has certainly been a
of course,
valuable
wherever I am,
discussion.
even when I'm retired
Oh, definitely.
on the beach of Baja, I'll definitely come back. As long as there's
Thank you.
Wi-Fi, we're good.
Thank you. So we would definitely make sure that we post the
Thank you so
resources
much.
that you provided to us. And then if we have additional questions, people
Mhm.
reach out to us. We'll certainly reach back out to you if they have additional
Of
questions that
course,
was not
anytime.
discussed. So,
Anytime. And I will try to put a list of resources together as well for the caregiver strain. But like I said, EAP, first stop if you're working. EAP.
okay. Thank you.
Yep.
Okay. Well, I'm going to say goodbye. Dr. AD and Dr. Yvonne, I'm not sure if we want to say goodbye. You guys are muted.
Sorry, the viewers that do
Lips
not
are moving, but
understand
I
what
can't see
EAP
or anything.
the viewers that do not understand what EAP
EAP,
means. EAP, the full meaning of EAP.
Oh, that's
Employee
employee
Assistance
assistance
Program.
program.
Okay. So
Yeah.
please,
Through your job. Yes.
you promised us you are done with the abbreviations.
I know. I can't help it. But thank you for bringing it back to life,
Thank you
back
so
to
much.
reality.
Thank
I
you
know.
so
I do that
much,
all the time.
Mari.
Yeah. So
Thank
thank you.
you.
Thank you so much. And hope to see you soon. I'll be texting you and make sure
Thank
that you're
you,
able to
Dr.
come back soon.
Yvonne. You have my number anytime at all, day or night. Feel
We'll
free.
definitely do.
I'm more
We'll
than
definitely
happy.
do.
Thank you so much.
Thank you. Thank you. Have a
All right.
wonderful, wonderful
I love
evening.
the work. I love the work you guys are doing. I
Thank
really do
you.
appreciate it.
Thank
Appreciate
you.
that. Yes. Thank you.
Thank
And
you.
thank you for having me, guys.
Thank you. Thank you for
Uh,
joining.
Happy Social Worker Month to me.
I know. Happy social work month to you. Happy social
Thank
work month. We
you.
certainly appreciate
Okay.
all the work that social workers do. So thank you so much.
Oh, you're very welcome. So since everybody's home, I won't say safe travels home. That's the
Yeah.
beauty of internet, right?
Yes. Yes.
Thank you, Linda.
Anyway, I think some people are preparing to travel back to Ghana, so still you can say that.
Safe travels. Safe travels.
That's
All
funny.
right.
That's
Good
funny.
night,
Okay.
everyone. And
You
thank you for
too.
being here.
Thank
Bye
you.
bye.
Thank you. Bye bye. All right. This is a great discussion. And Dr. Yvonne, thank you again for being a part of the discussion. Certainly looking forward to many more programs I had. Dr. Ada, you ready for us to wrap up?
Yeah.
Since we're
All
like
right.
3 minutes over.
Okay.
So thank you everyone for watching the program. We appreciate you joining us, and we'll be back, I believe it's April 12th, with our next guest, Dr. Sandra and Maureen, who will be discussing on how to lower your prescription costs. And again, that will be April 12th. If you have any questions or suggestions for the program, please do feel free to email it to emcuandyourhealth@gmail.com. Again, that's emcuandyourhealth@gmail.com. Thank you again for joining, and we look forward to seeing you very soon. Have a wonderful, wonderful evening. Bye-bye.